We do not cure patients with heart failure. Control them, we can give them nice quality of life.
My name is Marc, and we are at our next session for Beating the Odds Conference Conversations. We're talking about bold ideas, unforgettable moments, and provocative innovations in healthcare. I'm here with the amazing Dr. Anique Ducharme, professor of heart medicine at the University of Montreal, and also the founder and director of the Heart Failure Clinic at the Montreal Heart Institute. It is a real pleasure to be here with Anique. She is one of the most, if not the most, patient-centric individuals I've met in my entire life and continues to inspire me. So thank you so much for taking the time to be here.
Thank you very much. Disclosure, I didn't pay him to say so.
Just a little bit, maybe. Just a little bit. You know, we have a few questions for you. Given your experience, given your role across the country, your input that you have globally, what are maybe one or two key advancements in cardiology that you believe are making the biggest impact on patient outcomes today?
Only one or two. Well, for the heart failure and reduced ejection fraction, we now have 4 medications that reduce by 80% the risk of being hospitalized and 75% the risk of dying within 2 years. So those are like major advances.
Yeah.
But I would say probably one of the very important one is that we learn from oncology that patient awareness is key.
Yeah.
And we need to bring all those treatment to the patient, and this is a key role that Heart Life has played. So it's my turn to give you the kind word, because together we can improve benefits. Because if the patient comes in so late in the disease state, yeah, we can help them, but the earliest we put on board those medication, and if there are valve to fix and anything like that, well, we can really make a difference. So it's a team effort.
I mean, reduction in about 80%. That's a significant number. You and I talk regularly about the prevalence of heart failure across the country. There's a major problem. I mean, one of the leading causes of hospitalization, leading causes of death. Why is there not this awareness around heart failure as there are things such as cancer, for example?
I think there are a couple of points. Cancer is 25 years ahead of us.
Mm-hmm.
So they trace the way. Cancer survivor are very different from the heart failure patient, because we do not cure patients with heart failure.
Yep.
We control them, we can give them nice quality of life, or we can go to transplantation, but nobody is cured. And you know, it's very sad to see a kid with no hair, and it makes, whereas you people are invisible.
Yeah.
If we walk in the street, nobody would know. They would think that you're probably one of my son's friends or something like that. So
yeah.
This is very difficult to raise awareness.
It's an invisible disease.
Yeah.
You don't see it. I mean, like you said, we're walking down the street and there's always that misconception that, oh, that person, do they really have heart failure or cardiovascular disease?
You really sick or just lazy?
You're just lazy.
No, I have patients who've been told that.
Yeah.
I have patients who've been told that.
So what can we do then as patients, caregivers, but also healthcare professionals to maybe start to change that shift in mentality and that paradigm?
Well, I think the first thing, and next week is Heart Failure Awareness Week, is it's not normal to be breathless.
Yeah.
And so that has to go to the wide community, I would say, because physicians, either by ignorance or not really thinking about heart failure, and I don't want to blame the primary care provider. There are so many things to think about, but it would be very difficult to point a finger at them. But it's not normal. It's not normal even if you're aging, even if you're overweight. There's something. You should be able to keep up with somebody your age. If you're not, there's a problem, and there's treatment for that.
Yeah. And so and you've been, I mean, a real champion for Heart Failure Awareness Week in general, increasing awareness. And a lot of that comes down to patients and caregivers as well to advocate for themselves, improve their health. So if you could give one piece of advice to patients and caregivers to support their self-management, what would that be?
I would say, do not accept what is not acceptable. It's like people tend to say, okay, this is my fate, I have a heart failure. Sometimes they don't even know the options. We have now, we can implant mechanical support for patients who are not transplant candidates. And we have many other options. We have like a pulmonary artery pressure monitor so the patient can use their Lasix on a sliding scale like you do for
Yep.
diabetes. So there's a lot of options and things that we don't even know that are being discovered every week or so. Think about yourself, and I would say maybe yourself first, and there are options for
Mhm.
you, but unfortunately, the heart failure patient have to go and ask for what's available for
Yeah.
them.
Okay. This is fantastic. I just as a organization, we're so thankful for the work you've done. Again, bringing patient centricity to the forefront, and we are going to do something big for heart failure. We're going to do something like the ice bucket challenge. Even if I do it individually for you, I promise we're going to get it done. Anique, thank you so much. We really appreciate your time. Stay tuned for more conference connections. Thank you so much. Look forward to talking to you again. Thank you.
A pleasure.